All right, Sinead, I'm really looking forward to this topic. I think I'm going to learn a lot myself. And I just think that this is something that I wanted to cover for a few reasons. One, there's so many of our clients out there that are listening to some of the marketing that they hear online or through social media and thinking, wow, like how could I not buy that for my incontinence? That sounds like that's a no brainer. But then, we also have practitioners listening to this. And I mean, I think we're not necessarily up to date with some of the research on what's going on with these technologies. So I thought that it would be something that we can learn a little bit more about as practitioners to help understand, like, can these complement what our clients are being recommended, by us? And so thank you for being here.
Yeah, thank you for having me. I agree wholeheartedly that I think this can be important for both health consumers, but also for our colleagues, right? Not just our PT colleagues, our colleagues across all kind of disciplines. I do think there's some knowledge gaps, that kind of need to be sort of translated. So yeah.
Absolutely. Will you start by talking about kind of what brings you to this topic, or, what made you start to dive into the literature?
Yeah, so it's interesting. I mean, even if I reflect on sort of where I was at in my practice even 5 years ago, to be really honest with you, I would say I didn't have a very open mind, honestly, when it came to any adjunctive therapy, like to be really honest. I was starting to feel really, really confident with my skills as a pelvic health physiotherapist. I practice very much sort of from a health coaching, counseling style, coming from, private practice for almost a decade before I switched over to pelvic, seeing a lot of use of modalities and almost in my mind, like a lot of abuse in the system where, PTAs were having clients coming in and just putting all these modalities on them. And these people weren't interfacing at all in a counseling style with a really educated practitioner to truly sort of create health, right? So I think from that experience, I sort of had a bit of a negative perspective of all of that once I kind of moved into pelvic health. And it honestly took actually a colleague at McMaster University in the School of Engineering to kind of change my mind on this, which is sort of a funny story. So this colleague in the School of Engineering reached out to myself as a professor in the School of Rehabilitation Science, and then also to Dr. Donna Fedorko, who is a professor in OBGYN. And Dr. Fedorko and I, we had collaborated on a few things kind of in the past. And really what this fellow was looking at was actually a tool that was sort of manufactured actually in China, originally put on the market actually as a sex toy. But, this company was interested in sort of leveraging the capacity of this tool to actually be used in the space of rehabilitation to rehabilitate the pelvic floor. And so, I have to say, like, at first, I was actually kind of quite dismissive of the tool and the technology. I really felt like, sure, I'm happy to go along in this study. I always think there's something important to learn. We ran quite a rigorous RCT, but it was a mixed method. So it had a qualitative component to it. And that really is my area of expertise and research. So I thought, you know what? This will be fun to collaborate. I'm sure I'll learn something new. I can provide expertise around the qualitative side of things. So kind of let's go. And it was going actually through that trial. And particularly, I think, like, one, seeing the outcomes, but two, actually analyzing all the qualitative data, which were the women's perspectives, that really kind of showed me that my mind had been very closed, that not every woman is interested in seeing a pelvic health physio to help their problems. And, some women are really interested and intrigued by sort of these intravaginal devices they can use at home, but others actually aren't interested in that at all and actually found it a very cumbersome process to have to use something like that and would rather actually have a technology that they could stay fully clothed in. It would help them. And it was really interesting. So it was kind of through that study that I feel like that actually really opened my mind to be more open-minded about adjunctive therapy. And then it wasn't long after that I actually led the Society of Obstetricians and Gynecologists of Canada, their conservative care guidelines, right, for urinary incontinence. And it was, again, through that work, which I had other sort of lead authors on that it was evident that there was so much data on sort of our more traditional care options that are tried, tested, and true and have excellent science to back them up, right? Like individualized pelvic floor muscle training, of course. But there was actually so much data we couldn't include in our guideline because the studies didn't match our PICO questions. And these were all studies kind of around these emerging technologies and websites and e-health. So it was very obvious to us that once we were done the first guideline, we actually had to start another one really on some of these technologies. So that's kind of where I've gone to this. And now actually I'm leading again with others from the SOGC, a technological update on mobile health technologies for urinary incontinence. So that's kind of where I've come, and that's where I'm at now. And so I'm always trying to now be as open-minded as possible and just learn as much as I can about these tools that can potentially really, really help, but also can potentially be used in a very inappropriate way. And so I think it's important that we have a buyer beware, but we also know where the data is and how it could be helpful and how it could not be helpful. So that's sort of where I'm at.
I can relate. I agree. I definitely went through a phase where I was very dismissive when people would bring those up, like, how could that work? When you know how kind of the neuromuscular system works, I'm like, there's no way a device can do all of that for you. However, like you said, we have to meet people where they're at. And I think a lot of people are able to learn in different ways and are able to connect with their body in different ways. So let's kind of get into some of this so that people know what we're talking about. There's so many different technologies we could focus on, but for the purpose of time, we thought we'd focus on just a few. Let's start with the mobile health technologies then, Sinead. And can we talk about, well, actually, where do you want to start? Because I would like to move. Let's really quickly talk about. I want to talk about devices like Perifit and Elvie that involve actually inserting something into the vaginal opening and giving women feedback on their pelvic floor. I want to talk about the Emsella chair that you can just sit on fully clothed, and that this is going to help your incontinence. I want to touch on laser, and I also want to touch on some of these apps that are not based on any type of device, but that are rather targeting more, knowledge about the pelvic floor, behavior modification. So I'm happy to start wherever you'd like.
Why don't we actually start with that one? We can start with kind of, because what these apps are sort of defined as, like in the literature, is mobile health technologies. So if we were kind of talking about those apps that don't have an accompanying intravaginal device, we kind of have those, and then we can kind of almost move through. So when we think about these apps, right, these mobile health technologies, we see that there are more and more and more on the market, right? So I think the last time I looked at the data, there was like over 90 of these specifically just for incontinence, right? And then that begs the question, okay, but like, are they even useful? Like, do they even work? Are they effective? And actually what the data shows, so this is a category of research that's going to be included in our technical update, right? But also actually a colleague of mine, Stephanie Bernard, and she's a researcher in Canada. She recently published a systematic review, and it was quite a rigorous review of 12 studies actually highlighting, so these apps that are actually designed, as you said, based on content knowledge, but also that infuse sort of principles of self-management support, right? Little reminders for adherence, methods of sort of self-monitoring, right? So all of those tried, tested, and true principles kind of being delivered through this app, right? And then the question is, okay, is this even effective mode of delivery? And what we actually see is that we have level 2B evidence, so not as high as our individualized pelvic floor muscle training, but still much better than doing nothing, right? So we have level 2B evidence that on a variety of different outcomes, some of them being reduction actually of incontinence symptoms, but some of them being on satisfaction, on acceptability, right? So, I mean, these are a variety of different outcomes. But we do have some data to sort of substantiate this. And certainly from our review, we showed the same thing. You know, there's an app in particular that's been actually rigorously studied the most out of Europe. It's the TAT app. Mm-hmm. And really, I mean, this particular app, I think, has particularly good outcomes because it really does hit like kind of the cream of the crop sort of education around pelvic floor muscle training and really sort of the multifaceted nature of that, and really does a nice job of kind of including not just different sort of lifestyle interventions, but also kind of trying to incorporate some of the cognitive pieces, like around how you would properly implement this, right? So an app that's like that, that's set up really, really well based on all this kind of theory that's well substantiated. I mean, it's not a surprise that those obviously have better outcomes. But the point is, if we look at this and we kind of look at it in parallel, well, what have we learned through COVID, even just with virtual care? You know, I think that's been humbling for many of us who have really kind of assumed, well, every client or patient needs to see us and they need to kind of have an in-person assessment and we need to physically touch their pelvic floor to have any type of a benefit, right? But actually we show even in a number of guidelines that have actually come out in both urology, urogynecology, pelvic health physiotherapy, that our virtual care actually shows great outcomes, right? So I think we have data to support when we can't have in-person care. This is not to say that, you know, in-person care is still sort of like the top, right? But when we can't have that, if we can have really well-designed, sound mobile health technologies, that includes even aspects of a really good quality website or virtual care, you know, that's effective. You know, we should be understanding which ones are good and how can we kind of make these available for people.
I downloaded that app just because I knew we were going to talk about it and I wanted to see what it was like. And I was really impressed. And I think that I totally, you hit the nail on the head when I think a lot of people, I've created a few years ago, an online program to walk, probably something very similar to this app, based on so many clients coming to see me saying, where should I start postpartum? And of course I want them to come back and see me so I can individualize their treatment. But how many times do we see women coming in and just saying, I'm here to learn? And so they're starting at, you know, ground zero. And I think that there's so much that, you know, it's not just about us rubbing something or touching something. I think that our physical touch can be our assessment and treatment can be very important. However, we're talking about long-term changes or maybe understanding of your body and, you know, why you leak, or, you know what I mean? And so I think it's so important for us to understand our own bodies. And I find that over and over, people that work through some of this self-paced learning, you know, whether it's through an online program or this app, then when they come in for their individualized assessment and treatment, they are miles ahead because this isn't a new concept to them. And I agree. I think that I'm all for this because I think it puts some of the onus on the client too, doesn't it?
Yeah, absolutely.
Yeah.
So, I mean, I would say that's probably at sort of the one end of the continuum that we're going to be talking about in terms of kind of like the technology side or even like the invasive side of things.
Yeah.
So if we kind of moved along and said, okay, so that's mobile health technologies kind of on their own. And we move that along and say, okay, but what about these apps that partner with an actual physical device, right? So you mentioned Elvie and Perifit, and those are two big ones on the market.
Can I tell you what I see really quickly?
Yes.
When I look at their website, I just wanted to make sure, because I think some people listening will be like, what's Perifit or what's Elvie? And so I just went onto their websites before we recorded, and I thought I could really quickly say what it says, like the first couple lines, and then I'll get you to go into a little bit more detail. So on the Perifit website, you'll see, you know, it's a Kegel exerciser that lets you control video games with your pelvic floor. Quick and permanent results. It works so well that many doctors recommend Perifit to combat incontinence, prolapse symptoms, and other pelvic floor disorders. And then Elvie, similar in that it's an inserted device, better bladder control, it says, faster postnatal recovery, stronger orgasms. Okay.
Mhm.
So let's go into kind of, someone's listening to this and they're trying to picture what this looks like.
Right. So, what this looks like, and then I'll kind of speak to some of those claims that are being made,
Yeah.
right? So, what essentially it looks like is yes, you have your phone. These are Bluetooth kind of activated devices. You have your app on your phone, and this is kind of where the screen will come up that will tell you, like, if you are actually doing a pelvic floor contraction and how strong is it. And this is where some of these devices will use games and things to sort of motivate you to kind of take your pelvic floor essentially through sort of a varied workout of sorts, right? So this Bluetooth sort of silicone based device inserts vaginally, and then you're holding your phone and you're kind of going along. So you're sort of being motivated to exercise your pelvic floor by doing maybe well on a video game type of an interface. And then again, you're sort of getting some feedback, as to sort of how strong or not strong, your contractions were in a certain place. What I will say about Elvie, which I don't believe is the case for Perifit. Perifit is actually very, very similar. It almost looks the exact same as the tool that we studied for our study, which is called Eyeball, but they look almost the exact same. They're the same color. They're the exact same shape. They look almost identical, right? Elvie actually seems to have better sensory technology and better programming to remind you on your interface on your phone to actually relax your pelvic floor. Oh, you're still not fully relaxed, which I actually think is quite a good feature of that particular tool. But again, so we have this tool, so you can appreciate, okay, well, a benefit of this tool is that you can use it at home, right? Something you buy, you can use it at home. So like totally accessible. But it still does kind of require a setup of you have to lubricate the device and insert it and make sure you're kind of somewhere alone and your kids aren't around. So, I mean, there is still a little bit of a cumbersome process. And I will say that that came up a lot in our study. But then you have to think, okay, but that's worth it if the thing is really effective, right? So let's talk first about what you said about Perifit. So, this is sort of a Kegel exerciser. It's going to sort of give you like permanent results. So again, this is not to say that the concept of Perifit, which is similar to all of these things, isn't going to be useful, because I'll talk to that in a minute. But I still think those claims are a bit of a stretch. I also, based on the data we have, right? And so I'll go through that in a minute. We know that really, for the most part, to get permanent effects on anything, it means that some type of sort of regular behavior change has to happen, right? And so again, when it comes to the pelvic floor, in many instances, I mean, once we automate the pelvic floor again, we don't need to keep thinking about the pelvic floor specifically, but we do need to keep engaging in just regular full body exercise that will also keep the pelvic floor healthy, right? So it doesn't atrophy over time as we get older. So, a claim like that, I think we have to be a little bit careful of. And then the other piece, again, is just the terminology of Kegel. So the Society of Obstetricians and Gynecologists have been very clear in their incontinence guideline that we shouldn't actually use the term Kegel at all anymore. We should be using the terminology pelvic floor muscle training. The International Continence Society since 2016 in their terminology document have said the same thing. It's an unhelpful term because it means different things to different people. And we actually understand much better the multifaceted nature of kind of how the pelvic floor works to be functional. And it isn't all about strength the way we used to think. So again, these companies that are using this term Kegel, and I do think it's a bit of a marketing ploy because it's a term people are familiar with, but it's actually kind of incorrect. Right. Mm-hmm. And it is really promoting the notion of, an incontinence issue is akin to a pelvic floor that can, that either is or isn't aligned with a pelvic floor that can strengthen at max capacity and be held and then released. But we actually see from many reasons why women have incontinence, it actually has nothing to do with that. It has to do with their automated reflexes there. It has to do with something totally different. Right. And so I do think from that perspective, when claims are really, really like stretching, almost like it's too good to be true, be a little bit more cautious, right? When you look at the claims that Elvie makes, actually, they're softer claims. And actually, they're claims that technically are more substantiated by the research that that company has done. That company is actually yet to show really good efficacy outcomes, for incontinence or prolapse. And more of their studies have actually had to do with aspects of feasibility, right? I am not aware of a study on Perifit that shows that it improves prolapse, right? So again, that's a little bit of a stretch. That having been said, what did our study, because our study is actually the only existing really powered RCT that's a registered clinical trial on a device like this. And what we found was in our quantitative data, we found that our clients who got standard care, right? They were in the standard care group, but our standard group care was it's what standard care should be. It's way more than what standard care actually is. So the standard care group had a full proper assessment of their pelvic floor following the Perifit scheme and tenderness and tone assessed and all of those things. And they were also taught how to properly connect and let go their pelvic floor. They were also taught how to coordinate that with their diaphragm. So that was baseline for everyone. Right. And then they were encouraged to kind of be doing that, right, according to the guidelines. Then the people in the intervention group, they got that exact same assessment and those same instructions, but they also got free the eyeball device, right, and their phone and a phone to use, and they could go ahead and have that as their intervention, right? And what we found in the end was actually that there was no difference between the control group and the intervention group. So the addition of that tool didn't provide any additional benefit, right, from the quantitative measures. And actually, we found that everyone in our group significantly changed from beginning to end, which really, the most powerful thing out of that study is that every single person should just get that proper assessment at the beginning, right?
Totally.
But when you looked, so really the quantitative data didn't tell us much other than that quantitatively, that type of a tool doesn't seem to do much more if you had the benefit of that assessment. It doesn't tell us, though, what might that have done for you if you didn't get the benefit of that assessment, right? So I'll be very kind of transparent that that's a gap we have right now, right? But when you look at the qualitative data, that's where I think things were interesting, because that's where you could start to get and appreciate different preferences of women, right? And some feeling that, this actually was really helpful and actually playing the games was fun and it did motivate me to do my exercises. And I don't think I would have done them otherwise, but then other people saying, you know what, it was kind of a cool concept and I was excited I got in the intervention group. But actually at the end of the day, I really wasn't motivated to use it on my own. I would have been more inclined to go in to just another appointment with physio, right? And then other women saying, you know what, it was actually just such a pain that I'd have it all set up. And then like my toddler would come in the room that, I kind of was put off using it because it's a cumbersome process. And then you have your lube and cleaning it up. So it was really, really interesting kind of looking at that data. And so it showed me that, for some women, they loved it. They'd recommend it to a friend. But for other women, it just wasn't a good fit for them.
Absolutely.
So yeah.
I was sent a Perifit device to try. So I tried it and I thought there's no way I would do this, but I could see how, some people are very motivated by something visual. And I think at the end of the day, like if you know that incontinence, because we're talking about that specifically, is very much related to the pelvic floor in some aspect. So we know that there's some sort of dysfunction with the pelvic floor. We need to pay some attention to these muscles. But at the same time, it's not simply strengthening the pelvic floor. Just like if someone came into us and said, I can't throw a ball properly. Like I'm playing catch with my kids and I just it hurts when I throw a ball, or my neck hurts after, if we simply gave them strengthening exercises of their arm, just that, and didn't put it together in the bigger movement, which is throwing the ball, you're kind of targeting some of those muscles and helping, that group of muscles move through its range of motion. But we're not necessarily putting it together in the more complex movement or the complex picture, depending on when they're leaking, right? Something as simple as laying on your bed, playing this video game isn't necessarily going to take all your problems away if you're leaking when you're running or, you know? So,
and that's a really good point, because that was, again, some of the data that came through. Some of the women said, well, since I was taught and I had that feedback and that confidence that I actually knew how to do it properly, I was actually more inclined to kind of be doing that as I was lunging while I was standing at the counter. Whereas when I had this thing and I was limited to just being like flat on my back. And so again, it's not to say that there's no value of this, but there really is limited efficacy data of the kind of acceptability, feasibility data. There certainly is some, and I would say there is enough that it should be a consideration. You know, our study, I think, would show that it has the best leverage if it can be paired with at least one consultation.
yeah.
And that doesn't even, I would say, necessarily need to be in person. Like, now that we understand what we do about virtual care, but there was a few people who said, you know, I couldn't even imagine buying this just off the shelf and then kind of using it on my own. Like, I feel like I would need someone to like walk me through it, which of course with the study we did, right? So again, I think it has a place. I think, you know, certainly data shows that these tools, even without an intravaginal device, you know, have some benefit, better than doing nothing. But this type of tool would be better used, based on the study that we conducted at McMaster, you know, if it was, you know, correlated or kind of within the context of a healthcare provider, you know, assessment. And that doesn't necessarily mean it has to be a pelvic health physiotherapist. It can be a nurse continence advisor or a nurse or someone who has a lot of knowledge in this area, but someone to sort of guide the individual.
And really quickly, you can expect to pay around, I want to say what, between 100 and 200 Canadian dollars.
Yeah, closer
Something
to
like this?
200.
Okay.
Yeah, they run about $200.
Okay.
And I have heard of clients, in fairness, having it covered by their health benefits, right? Just like I've had some of my clients, pediatric clients, where I use TENS for their bedwetting. They've been able to have the TENS covered, or some of my clients that have, you know, that very specific TENS device for period cramps. They've had that covered. So sometimes these devices can be covered by insurance, but sometimes they can't, right? So it kind of depends on all those things. And they run approximately $200 Canadian.
I want to move to something more expensive, but less invasive, the Emsella chair. So if I take off some of the wording off their website, effectively stimulates the pelvic floor muscles with thousands of contractions per session. So again, this is a chair that you sit on fully clothed. It's intended to provide entirely non-invasive electromagnetic stimulation of the pelvic floor musculature for the purpose of rehab of weak pelvic floor muscles, restoration of neuromuscular control for the treatment of urinary incontinence. So they definitely stuck with it's for incontinence. So this is definitely, as I mentioned, non-invasive in that there's no device. You're sitting on a chair. I watched the video on the website earlier. It shows these women are very comfortable reading a magazine. And let's talk a little bit about that, because as I mentioned, this is definitely more expensive. But I'll pass it over to you, and let's dive into this technology.
Absolutely. So you're quite right. This one is more expensive. I would also say it's much more controversial. You know, it's interesting that, and I really feel like I potentially would have had the same reaction to this tool coming on the market now that many of my colleagues have, you know, had it come on like 10 years ago, right? So in a way, I sort of can appreciate the perspective, especially with some of the marketing claims. But it has been a little bit controversial, I think, particularly among pelvic health physiotherapists. And so what I'll say about this tool, though, interestingly, and I mean, you know, to be very upfront, the same, you know, colleague who I published this mobile health technology paper with, Dr. Donna Fordoko, she's OBGYN. literally like 4 or 5 years ago, we were at a conference together and walking by the exhibitors. And actually, they had this chair there. And she was the one who was like, oh, this is kind of cool, because she's a surgeon, right? She's a urogynecologist, but she's all about conservative care. She doesn't want to do surgery on people. She sees what a nightmare surgery is, right? So any type of conservative tool, she's open with. So she went over and she's like, oh, this is cool. What do you think? And I sort of laughed and made fun of it. Right. And so it's interesting. I just have a very different perspective now. But it is essentially what you said. It's a tool that provides neuromodulation. So basically a version of EMS into the pelvic structures, but not in the traditional way where we'd have our intravaginal probe and our client would be, at our session, we'd teach them how to use it and we'd send them home with their own probe. It's kind of in this more accessible way. And actually, there's much more data, efficacy data, supporting this tool versus sort of the Perifit and Elvie type of tool, right? But it has been controversial among our colleagues. And again, I think it is because of the nature of the claims that are made and also how expensive it is, right? So let's just talk about that for a moment. The claims that are made, and even one of the taglines of marketing for the manufacturer, which is BTL, claims that this tool does over 20,000 Kegels, in a 28-minute session. And so similar to what we were saying about the Kegel terminology with Perifit, I think the thinking there is to appeal to sort of the masses that people align Kegels with a pelvic floor that works and doesn't leak, right? Mm-hmm. But actually, that isn't really what this tool does. I've sat on the chair before. It actually takes you through an incredibly varied sort of workout and stimulation sort of protocol. Now, what it does do through neuromodulation is some of the aspects of that sort of waving fitness program really do sort of super maximally contract these muscles, probably in a way that would be difficult, if not impossible, for people who don't have kind of optimal sort of neuromodulation sort of restored to do on their own, right? So there definitely is something working at that level, but I really don't believe at all that the mechanism of what that tool is doing is what it's marketed as. And I think that's one of the reasons why pelvic physios have kind of turned a blind eye to it, because they understand from the clients they're working with that many of these women's issues, if they were doing super max contractions and holding them for 6 to 8 seconds and doing them again, and not with sort of any focus on all the other domains of what actually makes a pelvic floor really smart, right? They know that they probably wouldn't get anywhere. And actually, they'd probably make some aspects of the woman's issues worse, right? So that sort of technology, or that marketing rather, I think is a problem. And it does also have a really high price tag, right? So I think for the most part, places it's running like approximately $300 a session. That having been said,
and you're supposed to that initial treatment is supposed to be about 6 sessions. Is that correct?
Yes. So most of the studies looking at this have looked at a basket of 6 sessions. There's one actually pretty well done study that has actually looked at 10 sessions, but most of them have looked at 6 and have shown good effect in 6. And so that's kind of why 6 has been chosen. I think for these places to guarantee effect, like not wanting to have less than that because, less than that hasn't been studied to show effect, right? So you're quite right. 6 sessions at that price tag. But just because of the price tag and what I would argue is actually incorrect marketing or explanation of what it does, doesn't take away the rehabilitation potential from this tool, which the data shows us that it's good. And all of the studies looking at this have not situated using this modality in addition to all of the other things that we would do as physios, for example, or even all of the things that actually the apps do. Educating about the pelvic floor, educating how the bladder works, educating about, principles of healthy bladder habits, right? These trials are literally, you go in, you sit on it while you're reading a magazine. And even just with that, we see in the trials that we have some effect. So when we actually translate this to the real world, I've had a chance to actually sort of consult with a couple different clinics sort of here in Ontario who are using this tool. And these are clinics that were very, very motivated to use this in a really responsible way, very much from a rehabilitation standpoint, right? So what we see is that when this tool is used, kind of like any other adjunctive therapy tool that we might use as pelvic health physiotherapists. So the individual is assessed first. They are getting their personalized care plan that includes this as an adjunctive modality. I mean, we're seeing fantastic outcomes and women being so happy that they can just sit there fully clothed. But are they sitting there and just reading a magazine? No, when it's delivered in this context, they have a whole team of clinic workers who are reinforcing aspects of their personal sort of treatment plan the whole time they're kind of sitting on the chair, right? So I would argue there's sort of like a good way and a not so good way to integrate any type of adjunctive tool. But this is one that I feel like has unfairly got a bad rap, partly from marketing from the manufacturer, but I think partly too from maybe the price tag. And I think sometimes as healthcare providers, we make assumptions about how our clients might value spending their money. Like I've been very frustrated with physicians over the years who have made assumptions that clients wouldn't want to pay for a physiotherapy consultation. They're like, oh, well, physiotherapy is too expensive. Our clients can't afford that, right? And it's assumption, because actually, if you talk to that person and said, well, this is how much you're spending on incontinence pads a year. This is like, would you see the value in spending $150 in meeting with a person? And usually the answer is, oh, yes, I just didn't even know it was an option, or I didn't know it would be effective, right? Mm-hmm. So I think we can't make assumptions of what people, determine is a valuable use of their money. Right.
Yeah.
So that's also kind of one thing I would say. But yeah, I definitely think we're going to see, we have a number, and I shouldn't say we, there are a number of research groups that actually are running massive trials actually on this technology at the moment. I had a chance of hearing what the interim results were at a conference in Nashville last year, literally right before COVID. And the results were really, really impressive, right? So I think these big powered trials are going to be published soon. One of them actually does integrate pelvic health physiotherapy with it. So I think this is going to be up and coming. And I would encourage our colleagues to learn a little bit more about this before dismissing it. But certainly I would say to, health consumers, if you're going to use a tool like this, don't just kind of walk into a cosmetic medical center where you're not assessed. There's not sort of a team of providers. It's not offered within a customized kind of program, right? Seek out one of the places that is delivering this care in a really responsible way, and then you'll get much better results.
Mm-hmm. This is something we've talked about, outside of this episode, about how I've found the same thing. We've talked about how we'll have clients that say physio hasn't worked for me,
right.
but I don't want surgery. Or you'll hear people that have tried this option, this technology, and say it didn't work for me. I had to keep going. And I think exactly, like if you marry the two, everybody needs something different, and we have to meet our clients where they're at, and just being able to explain, like, this is what this device can provide. But if you don't have an understanding of the anatomy or of long-term behavior changes that you can make or accompany with this technology, you might not see these lasting changes you're looking for. But exactly, I think that, I think we need to be better at combining some of these technologies because a lot of our clients are interested in, as you're mentioning, there's a lot of data to support them. But we do tend to see them, I think, as competition sometimes. When in reality, I've been in contact with a clinic in town that has the Emsella chair, so that I can go meet with them and bring some of this, of what I do to them, because I think that just starting these clients with the education along with their treatment, I think could go a long way just to start with.
Absolutely. Yeah. And I couldn't agree with you more. And I think you nailed it. Sometimes I think we can feel, I think especially maybe as pelvic health PTs, sort of like we kind of own the pelvic floor, and we can feel a little bit threatened with
Mhm.
something else coming in. And I think too, we can feel almost like protective mothers about our patients, and we don't want them being scammed
Mhm.
and wasting money. So I mean, I think there's a lot of reasons why. But again, it's to not throw out the baby with the bathwater, right? It's to acknowledge, there still is some value, and it's a matter of how it might be situated,
Mhm.
right? So yeah, I would agree with you 100%.
Can I move now to the last one that I want to talk about, which is laser?
Mhm.
And this is another one that I actually just had a client the other day say to me, you know what? I'm just going to wait for this last baby to be born. And then I can't wait to go have some vaginal rejuvenation,
Mhm.
And so let's move to that. And
Yeah.
I know that we're talking specifically about incontinence today. Um, but there are some, there's so many different types of laser too. And I'll be the first to admit that I don't know what they all are, but I know the
Mhm.
Mona Lisa is
Mhm.
a big one that lots of women
Mhm.
hear about. And if I just quickly read something off of their website, Mona Lisa is a painless and minimally invasive laser treatment for vaginal rejuvenation. By gently acting on tissue of the vaginal mucosa, the laser stimulates the production of collagen, improving the functionality of the treated area and restoring the proper trophic balance to the mucous membrane. And
Yeah.
I believe on that website, I shouldn't say because I looked at so many, but I believe it was talking about, for, lubrication, sexual function, and I believe it mentioned for the treatment of incontinence.
Yeah. So this is an important one for us to discuss. And I guess what I would say up front is, in ways I almost don't even really consider this tool really within the basket of conservative care, because it's almost kind of going across the line where it's kind of almost really in that medical domain. And the reason why I say that is because it's termed as minimally invasive, but it's still invasive. And also, you have to be an MD to actually administer it, right? So it needs to be administered by a physician, right? And so, when we look at, okay, and certainly in Oakville, Ontario, which is where I am, there are a number of OBGYNs who utilize this in their practice. They market it for incontinence. Some of them even market it for prolapse, mild prolapse. And it has a price tag of over $3,000, none of which can sort of be reimbursed.
And is that a series of treatments, Sinead?
Yes, it's 3. So it's a package of 3 treatments. That is $3,000, and it has to be sort of delivered by a physician. And then we think, okay, well, again, if a woman kind of goes through these 3 treatments, pays that money, but it truly does ameliorate her issues, gives her her life back, great. I think that's excellent. If we know it's safe and effective, then women should have every single different option available, and they should be able to choose, right? But actually, when we look at the data, we see that it isn't actually effective for incontinence. So even at this year's Incontinence Society conference, there was a number of studies and systematic reviews and meta-analyses specifically on laser. And you're quite right. Mona Lisa is the main one. So certainly in Oakville, where I am, it's the only one sort of that the providers are using. That having been said, another issue with the research is that there are quite a number of different lasers. So it is hard to actually combine the data together because it's quite heterogeneous in terms of what the actual treatment protocols are. But if we're kind of talking about the Mona Lisa specifically, we see that actually the science shows that it does actually change the collagen tissue. Like histologically, it does change the tissue. And we also see that it does seem to improve the symptom of dryness, right? So when we talk about urogenital symptoms of menopause, right, there's a number of those. And vaginal dryness is a big one, but increased urinary incontinence is a big one, right? So we do have some data to show it improves with the one symptom of dryness. And from a tissue perspective, it does seem to actually do something to the tissue, but it consistently shows that it is not effective for incontinence. The other thing that I think is really important is that both the Society of Obstetricians and Gynecologists of Canada, but as well as the International Urogynecology Association, they both put out statements in 2019 indicating there is not enough safety data. They do not, as organizations, recommend this, right? So I think, again, as physios, we talked about the other options, and those all really being options we should learn as much as we can about, so we can be translating that information to clients, because those probably will be useful adjuncts, depending on the person, depending on their preference. This is a tool where I think our role is more being aware of the current position of, the associations. So, really for us in Canada, you and I are both in Canada, being aware of the SOGC position, which is currently, there's not enough safety data. And then also being aware of, even if you take the safety bit aside, there still isn't data to support that it is even effective for incontinence. And that's an important thing for us to communicate to our clients. So they might think, okay, well, I was willing to drop this amount of money, maybe I'll go for the Emsella chair instead, right? Where there's way better data to support it. There's no safety issues. So I think that really is our role. And that's not to say that, these lasers technology won't change over time. And maybe it will get to a point that there's enough years that have gone past that it is deemed that, no, these actually are safe. There aren't that many adverse events. And actually, we've changed up the technology. And by some of the changes we've done, it is effective. Or, oh, it is effective, but it's effective when it's used alongside pelvic physio, for example. Because again, these studies, they look at it on its own. And really in care, it's not used on its own. Hopefully it's used within the context of other care. So that's not to say this one might not change, but again, it's not something ever that a client can kind of sort of really do with the involvement of a PT, because it requires a doctor, right?
Mm-hmm. Interesting. I think in listening to all of this, those are the main devices that I wanted to cover. And in listening to all of this, I think it's important. There's lots of data to support seeing a pelvic health physiotherapist. We know that. But I think that it's important for us. Our part of our role is to keep up to date with some of everything that's going on in some of this technology, which is what we're talking about right now. But that also just remember, everybody's coming from a different place. Everyone has a different way that they learn. And I think finding the way that helps them kind of, not only address the muscles themselves, but address how those muscles work throughout the rest of the body, how to integrate it into the activity of their choice, and how just to fit it into their life for long-term well-being and success. Right. And is there anything else specific that you want to put across, Sinead?
No, honestly, I think you summarized it well right there. Any of these kind of tools, you're right. You can look at them as in a myopic box, but you're quite right that for any of that benefit to really realize its full potential, it needs to then be kind of moved and integrated into the rest of the system. And so it kind of does show that when we are using these tools as adjuncts, that's what they are. They're adjuncts, right? Really, that's how I think they are situated best, is not, this is, my treatment I'm going to do to fix everything. I'm just going to buy a Perifit and expect to have the best leveraged opportunity, for restoration out of that. Well, no, but if that's alongside some sort of counsel of someone who kind of really can personalize it to you and fill in all the extra bits, that could be an incredible addition, right? And the same thing could go for kind of some of the other tools. So I think you're quite right. I think it's important for us to consider adjunctive care, in addition to the amazing care we provide, but what are some of the different adjuncts and some kind of maybe being better fit for some people versus others?